in. If you can hear a noise, like a buzzing, it's my fan, because I'm a bit hot. Don't know if you can hear, but I'm still a bit poorly. So it's not going to be a long vlog, but some people like shorter vlogs. It's not a vlog anyway, is it? It's a fibro section. That was the air freshener. Anyway, fibro section. Bling, 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 bling. And this week, bear with, this week it's going to be on, funny enough, being ill on top of being ill. So, as all of you that follow my vlogs know, I'm going to turn that off because it might be a bit annoying. I have been ill since Sunday before last with what we call muggle illness, like viral cold, cough, throat thing. So I thought it would be really a good time to go through our immune system. Right, okay, so I don't know if many people know this, but fibromyalgia isn't classed as an autoimmune disease or disorder. It's an autoimmune disorder. And I'm reading off my phone because this is where I've done all my research. It says it isn't classed because it doesn't cause inflammation. So if you've got like arthritis or something like that that does cause inflammation, then it does qualify as an autoimmune disorder. But fibro doesn't. But there is a but. Saying that, I went to counselling today and we were talking about the fact that I'm really struggling to shake this illness off, and she said that fibromyalgia is autoimmune because of what the brain is doing. So she said with your brain, with the, have you heard of the fight, flight, what was it, fight or flight, is that it? So it's the response, so to something, if you're, you know, you don't know whether to fight it and or run away. Well, if you don't have that and you're still stressed out and have a lot of things on your mind and you've got this adrenaline rush in you and the adrenaline's got nowhere to go, that's what causes the immune system to not work properly. So anyway, so it's debatable whether it is, it's not actually in medical terms classed as autoimmune, because I know that, because if it was, you'd be able to get a flu jab, but you can't, you'd have to pay for it. I know it's a bit confusing, but I thought I'd clear that one up first. Right. The research I've been doing says we have fibromyalgia and chronic fatigue syndrome. Aren't we sick enough already? Yes, we are. But that doesn't mean we're immune to get all the bugs that go around. Whether you get a bad case of it or not, you're likely to feel it more than most people, and illness can trigger up a flare. So, like someone said, let me find the example. So this example is really good at explaining that a bit better. So she says, yeah, maybe it's just a cold or just a sinus infection, but to us, it feels like terrible flu. No, this is not comparable to a man cold. These are symptoms we already have every day, mixed with the new symptoms of whatever we have now. So she says, take my fibromyalgia for instance. Every day I feel like I have been carrying around 20 pounds on each arm the whole day. My head swims and I am often confused. My joints hurt every time I move, even more if there's bad weather. And some days I have so much pain I can barely get out of bed. My body itches, my joints grind, my muscles are tight and won't loosen up, and I have problems seeing straight sometimes. Right, now let's add the symptoms of a common cold. More muscle pain, yes, it gets worse. Nasal congestion, runny nose, coughing, sneezing, chills, fatigue, fever, watery and itchy eyes, sinus pressure, headaches, chest pressure and discomfort, sore throats and mucus build-up. Perfectly healthy people only get the cold symptoms. People with chronic conditions get all the cold symptoms plus everything else that they get every day anyway. So try to imagine having to deal with that. Imagine dealing with fibromyalgia symptoms every single day, then add on all the cold symptoms for a couple of weeks. It can turn a small cold into something very big. Yes, it will pass, but it can still put us in bed if we have flu or pneumonia or just a cold. It can put us in bed like it did me a couple of days. So it says, if you have a loved one who has a chronic condition like me, please understand that they can't just bounce back like you might do from a cold. They can't go to work with a little cold and they can't ignore it. So I thought that was really, really good, because it's very frustrating getting muggle sick, we call it, like Harry Potter muggles, which mean non-magic folk, normal people. So normal people's illnesses, on top of our already illnesses, it's really hard. It's hard to deal with it. It's hard anyway. So, and because of all the other things we've got going on, it takes us longer to get rid of it. So yeah, talking about that a virus can trigger a flare as well. I had a flare up last night of pain in my leg, and I know a lot of that is stress as well, but I know this cold has made my pain a lot worse. So any virus can trigger a flare up, and it's often viruses and infections that bring on fibromyalgia in the first place. So you have to be a bit careful of that. And the longer the sickness sticks around in your system, the more chance it has to increase inflammation and further weaken your natural defences. So then you might be catching something else as well. In turn, your body is at the mercy of other foreign invaders that can bring more serious complications like tonsillitis, bronchitis, sinusitis or pneumonia. Treating the infection with fibromyalgia can cause extra discomfort, since antibiotics for bacterial infections and even over-the-counter cold medication tend to irritate the stomach. And if you're someone that suffers with IBS, like me, it then can trigger your IBS attack. So it's not, for us, it's not just having a cold. It's not like, oh, you've just got a cold. It's not like that. So how to cope with when you're getting poorly and having fibromyalgia? I mean, the most important one is stay hydrated. I actually put lemon in my water because it tastes nice, but also because of all the vitamins in there. So stay hydrated. It's more important than ever to drink lots of water, manage fevers. I have been taking paracetamol every 4 hours, but I've started taking Sudafed because of this thing I've got in my, like with the sinuses, but that has got paracetamol in it. So treat all symptoms. It is a good idea to ask your doctor about cough and cold medicines, or you could ask your pharmacist. Like, you could just ring up, or if you can't get in there, and just ask them if the medications you're on, if it's okay to take the other medications. I haven't done, because I know Sudafed and paracetamol and things like that are fine with what I'm on. But if you're worried about that, you could ask. Get plenty of rest. Adequate rest. I can't speak today. Adequate rest is important for people with fibromyalgia or the flu. Getting enough rest and sleep can help your body to recover faster. And obviously, sleep is difficult for us anyway, so sleeping with this is even worse, I can assure you. Like, try not to cough all night, and then try not to be awake with the pain, and it's a vicious circle. But I refer you to my sleep video. I will link it above so you can have a look at that after you've watched this. Use heat therapy for muscle pain relief. Fibro pain can spread and spike rather quickly once an illness takes hold, so use heat pads, muscle relaxation, stretching. Watch my stretch video, I'll link that above as well, to keep yourself comfortable while your body overcomes the viral invader. So yeah, even though you must rest, you also must keep moving and stretch and things like that too. That's really important. So it's just getting the balance right. What I'm doing at the moment is I'm doing like a job and then having a rest on the sofa for half an hour or so, and then doing something else. That's how I'm managing. Prevention. So flu, you can pay to have the flu jab. I haven't done because I've heard a lot of people that get flare-ups and things from having the flu jab, or they get flu symptoms, and a lot of people have, it's a big argument because a lot of people have argued and said no, it can't give you the flu, it's just a coincidence. But I haven't done. I don't think I will this year, I'm not sure about next, but I haven't got the flu now. I've had just a viral cold, throat and chest thing, so but we feel like we've got the flu every day anyway, don't we, to be honest. Oh, and obviously take vitamins, eat well. So I take vitamin B, garlic tablets, things like that, vitamin C, zinc. They're all good at magnesium as well. I take that every day anyway. And what I've been taking every morning is echinacea. Echinacea is a really good preventative, or not even preventative, it's when the first sign you get ill. And they also do a spray that I haven't used, but Mark's used it before and it's been really good. It's called First Defence. So when you feel yourself getting a cold or a sore throat or something, you use this spray up your nose, and I don't know if it's going to stop it completely, but it will stop it getting too bad. So I didn't get that, but I would have used it if I had it. So obviously eating well as well, plenty of fruit and vegetables, drinking water, all of the usual things to try and keep yourself as healthy as possible. The most important thing as well is to wash your hands all the time, or hand gel. I'm nearly out of this, but the antibacterial hand gel, I use this after I blow my nose so that I don't pass on any bugs to anybody else. Or I wash my hands before eating, wash my hands before drinking, anything like that that can prevent, because you can touch things and they're everywhere, door handles and things like that. And in the home, it's a really good idea to get the Dettol spray and just spray either the door handle directly or onto a cloth and wipe it over, and that kills all bugs and things like that. I also clean down the fridge, the side of the fridge where people are opening it, freezer and all things like that can contain all these germs. So we've talked about sleep, and obviously I'll refer you to my sleep video. We've said about vitamins. Oh, they also say vitamin D boosts immunity. I don't actually take vitamin D. You know why? Because I have blood tests every few months and my vitamin D levels are very good. So I thought, well, I don't need to take extra if they're already good. Omega-3 fatty acids fight inflammation. Vitamin C, I've said again. Right. I've just clicked on my phone for the next thing that I was going to show you, and it comes up with that. Chicken nuggets. Chicken nuggets fix everything. Sad nuggets, hungry nuggets, bored nuggets, end of the world nugs. Because I saw that on Facebook and I thought it was hilarious, because Poppy loves nuggets and she said, yep, it's basically what's on my mind all day, every day. Anyway, so if you get muggle sick on top of being chronically sick, then my advice is what I've done. Keep warm or keep cool, whichever one you need to do. Drink plenty, take your vitamins, eat well, rest, but also stretch. Listen to your body, listen to what your body needs, and remember that it isn't going to last forever. I mean, this is like since the Sunday before last, so this coming Sunday I'll have had it 2 weeks, but apparently that's perfectly normal for people with fibro, so it won't last. I mean, the same with if you get a sickness bug, it's going to irritate your IBS and everything else. It's trying to deal with things on top of things. But the most important thing is to rest. And if you do work, and if your worker being a bit not very understanding about the fact that you're muggle sick, and they're like, well, it's just a cold, you can come in, then you can show them this video and they can be educated into what it's like to be ill on top of being ill. I know this is short and sweet, but I need to go and drink a lot of water now before I have a choking fit. I am so praying that this cold and everything goes soon because I've had enough of it. So please keep warm, keep hydrated, keep doing everything, and I will see you on Saturday for the weekly.